Okay, well, my name is Dr. Regina LaRocque. I am a board member of Sustainable Wellesley, and I am also an infectious disease physician, and I live here in Wellesley. And I am continuing with these series of Facebook Live events to answer questions and be available to discuss the coronavirus situation. And I will say, as I've said before, that I'm just speaking on behalf of myself and not representing the organizations I'm affiliated with in particular. Um, this is my first time doing the video on a different platform, and I am going to wait and see if there are any questions that pop up, because this time I did not have a list of questions in advance, which is the way we have tackled it before. Um, all right, well, I'm actually not seeing any questions, and I'm in touch here with Phyllis. Um, so I think I'll wait another minute, but if there aren't any questions, then I will hold off on proceeding. I'll just make the point that we are going to be having a Sustainable Wellesley action meeting on June 2nd at 7:30, and it will be done on Zoom, so hopefully everybody can join us then. Ah, there's a question. Okay, well, that makes me feel um, like it's okay to be on this live stream. So, great. All right. I was halfway thinking about going to clean up the kitchen. So instead, I will stay and have this chat with a few people. So, Ashley is asking about my thoughts on opening up schools in the fall and whether it's too early to make decisions right now. I think it's a really good question. It's something that we're all thinking about um, a lot right now. And I know that there are certainly many universities that are beginning to make plans available about what they think they're going to be doing in the fall. Um, if you ask me, I think that it is really too early to have much confidence about where things are going to be in the fall. I think all of us in the infectious disease world are watching what's unfolding with a lot of trepidation right now. I think we are seeing that different states around the country are embarking on reopening plans at kind of their own pace, and Massachusetts is also in the midst of a process here. But I think that we all appreciate that the situation we're in right now is pretty fragile, and that there is a lot that depends on how things play out in the next couple of months or weeks. That really just depends on what happens with this letting down of the safeguards. And it's definitely the case that as we let safeguards down, there's going to be more cases occurring. And even here in Massachusetts, we still have ongoing many cases and a reasonably high number of deaths on a daily basis. So I think it's rather certain that we're going to continue to see a lot of coronavirus activity in the coming weeks. And I frankly anticipate that we likely will have another surge at some point. So I think that's kind of the perspective that we in the infectious disease world have on this. So in that light, it's difficult to contemplate what school would look like, because I think that the situation for the communities is still going to be quite difficult, even through the summer and into the fall. I mean, essentially, we're really just biding time until we have a vaccine or another approach for getting the transmission under control. And if you think about the types of interventions that we're having to take in order to keep things manageable, the big one being distancing from other people, that is such a fundamental piece of the control efforts right now that it makes it very difficult to imagine that you can have school in anything at all similar to the way we are accustomed to having it operate. So there needs to be just I think a realistic assessment of the fact that we certainly aren't going to be able to have anything operating in the schools in the way that we are accustomed come the fall. I just don't see that happening. So I think whether school happens or not, I think depends on what kind of creative approaches we can take to making those situations safe for the kids and the teachers. And perhaps there are some ways to be creative about this in terms of segregating groups within the school or staggering the day. But there's going to be some serious trade-offs to be made in the course of doing that. And I think the group that I'm most concerned about is the teachers, because they're going to be exposed to a lot of kids, and kids are not all the best about washing their hands and taking care of their respiratory secretions. And these are going to be adults who are older, some of them, or who may have medical conditions. And so I think whatever systems begin to be considered, we really need to have at the front of our minds how we keep teachers and staff at schools safe. And that's all going to be very logistically complex. I mean, I think all of us in the world, just looking at myself to see if I'm actually on the screen here, I think, we're all struggling with the fact that our kids are not in school. And I think for people who work, it is such a fundamental necessity to have childcare and a place for your kids to be during the day, that these are complicated society level issues that we have to figure out together. I did see an interesting piece that kind of just calculated how much of the school day you would have to spend having the kids wash their hands. And it added up to a rather substantial number of hours over the course of the day. And so, like, just on a very simple basis, there's going to be a lot of things that we are going to have to put in place that are not simple. Riding on a bus, you can't have a crowded bus of kids, washing hands, bathroom facilities. These are some really big cafeterias, food service, cleaning. It's really impressive. And so I think there's going to have to be some rethinking of what school looks like. And I'm quite confident it's not going to look like what we're accustomed to seeing. And I will say that I just think I think this is one of the hardest things for all of us, is just the degree of uncertainty that we all have to deal with. But I think the fact of the matter is that it is pretty early to be able to make those kinds of decisions. I think it's probably appropriate to now be taking a hard look at what some other countries have been doing with their schools and their childcare situations, and try to learn some lessons. One of the complicating factors superimposed on that is that, we really don't have a federal strategy for managing this. And so it means that every state, every community is going to be faced with having to make some decisions for themselves. And that's a hard thing to do. It takes a lot of expertise and time. And also, frankly, we still are very connected to what happens in other communities and other states. At some point, and it's already happening, people are beginning to move around. And so, what's happening in Iowa is going to make a difference to us here in Massachusetts once people resume travel again. So let's see. Here's another question, which is, any thoughts on the advisability of reopening salons, beaches? Yeah, so I think that what's happening with the activities in the state right now, I think, is foremost on most people's minds. I think I've personally been pretty willing to speak publicly about my perspective on the process, which has been that I feel like it's obviously much desired by everybody to begin to resume some degree of normalcy, and I absolutely have the same feeling myself. But I have had a lot of concerns about the fact that we are in a pretty fragile state in Massachusetts right now, and that there's not much margin for error with some of this resumption of activity. There was a model that came out from Imperial College London on May 21st, which is worth reviewing. And of course, models are just, no, they're not written in stone, and they're not always correct, but they give you an idea about what possible outcomes could occur. And the predictions for Massachusetts were pretty alarming. If even with resuming 20% of the activity that we had been engaging in before the lockdown began, we stand to have a very significant number of cases occurring, up to 500 deaths a day by some of the accounts. So the point just being that we're in a pretty fragile position. And I think that our current process has not really adequately accounted for what our failures were in the first place. So I think we've lacked some protections for frontline workers all along, and it's unclear to me that we have set up those safeguards now going into this next phase sufficiently. So I think that relates to the question of thoughts on the advisability of reopening salons and beaches. I mean, to my mind, the things that we could be and should be reasonably thinking about doing are really outdoor activities, since we know that the likelihood of transmission, I think, in an outdoor setting that's well ventilated, where people are separated, is really quite low. And so I feel comfortable with outdoor settings where people are able to separate themselves. I do worry a lot about the parameters that have been set in place for houses of worship, and I am concerned about hair salons as well. Um, Mostly, again, concerned for the people who work there because, cutting somebody's hair means you're standing very close to them for a significant amount of time. And I think that it's a hard thing to do safely right now. So I'm not sure how we're protecting the people who are doing those types of activities. As far as beaches, I think that, again, of all the types of places that it would seem reasonable to, begin to loosen the safeguards a bit, it's the outdoor spaces where people can be spread out. It was a little disheartening to see some of the pictures that came from, beach communities like my own in Florida, Cocoa Beach, of people who were really not adhering to the recommendations to separate. And so, I think that the truth is really in the numbers, and we're going to know soon enough, how we've been doing with this, and we need to watch very carefully. I think one thing that's worth acknowledging about the data is that there still are just a ton of limitations on the information that we have in Massachusetts to make our decisions. I think it's worth taking a good long look at the dashboard that's come out from the state Department of Public Health. It does have some important information about which communities look to be more affected, but there's still just a lot we don't have in terms of which workers are getting infected more, which communities have a rising number of cases versus a falling number of cases, where have most of the deaths been. I think it was just today that we were beginning to see kind of which nursing facilities were the ones that were most, that have been most severely hit with deaths. And so I think that, we just don't have all of that information. And that is something I think as the systems continue to get stood up, we'll know more. But it's just important to take a look around at the people who live in these communities and in these settings and understand what they're seeing on the ground, because the data is going to lag a little bit. And I do think that, the nursing facilities in Massachusetts, we really need to take a good hard look at what happened in these settings that allowed coronavirus to just cut through, like a flame. And I'm not sure that we necessarily have the frequency and rapidity of testing and the degree of infection control that you would need in order to make these kinds of settings safe going forward. And so that has a lot of implications for how we operate our healthcare system here in Massachusetts. All right, well, I don't see any more questions popping up, so I'm just going to make one comment about something that I think I've been asked about, which is about having people come in to clean your home. And I think that it's something people in Wellesley have been thinking about. And I just want to raise my concern, which is that, anybody coming into our house, we have to consider that they are being exposed to every person we've ever been around and vice versa. And so the people I worry about the most when it comes to house cleaning and things like that are the workers. One reason being that these are people who don't have kind of workplace protections that you would have if you worked in a more formal setting. And so I just worry that they're prone to be taken advantage of in terms of the safety of their workplace. And so, if you worked in a store or a restaurant, there would be requirements for your employer to certify or at least agree that they had complied with the mandatory, not the mandatory, the recommended cleaning and distancing guidelines. But for somebody who is just a domestic worker, those protections are not in place. And so I think we should take that responsibility as an employer seriously. And I'm not sure that I can set my home up in such a way that somebody coming in can clean it safely. So I myself don't feel comfortable with inviting people into my home to clean, mostly because I'm worried that they are going to get exposed to my, my home setting, and that there won't necessarily be recourse for them if they get sick. So these are the considerations, I think. Well, I just appreciate the opportunity to take questions, and I encourage everybody to consider attending our Sustainable Wellesley meeting on June 2nd. I think that one of the things I've learned from all of this is that there's tremendous overlap with the concerns that we all have about climate and health. And I think that I'm hoping that we will pivot some of our attention and our thoughts about how we rebuild our society and our economy after this to making sure that it's in better shape for the next generation and our own selves in terms of our impact on the environment. All right, well, I appreciate the company, and I'll be available again next week on Thursday if anybody wants to pop in again. Good night.